Yes, Dipanjan. Good afternoon, everybody, and thank you very much, Dipanjan, for making me a part of your course. I take your permission to leave after my talk as I am in the outpatient. So, when to prefer ologen? So, trabeculectomy does remain the gold standard for surgical management of glaucoma, and surgical techniques have developed over the years. And mitomycin C, you've heard Dr. Shichandra presented that very well, was applied as an antimetabolite during trabeculectomy. And however, with mitomycin C, we do see some adverse effects like vascular filtering, blebs, cataract formation, and thinning of the conjunctiva. So focus is always on to develop less toxic agents and implants to inhibit cicatrization without adverse effects. And there comes in the ologen implant and to serve as a placeholder and prevent conjunctival scleral adhesions. So that's the ologen on your left that you can see, and that is the microscopic picture. It is a disc-shaped porcelain derived biodegradable scaffold collagen matrix implant, and it is composed of more than 90% lyophilized porcelain collagen and less than 10% lyophilized glycosaminoglycan, and a pore size of 10 to 300 mm. So ologen implant leads to a non-scarring wound healing with a prominent filtering bleb to enable successful surgical outcome after trabeculectomy. Ologen implant is biodegradable in 90 to 180 days or more, leaving a porous scaffold. So how the ologen works? The ologen implant induces a regenerative wound healing process. It works by guiding fibroblasts to grow through the matrix scaffold in a less random fashion, thereby preventing the fibroblast from laying down in an organized fashion, reducing scar formation. And it acts as a reservoir as the aqueous humor is absorbed into its porous structure, and it acts as a spacer and mechanically separates the conjunctiva and the episcleral surface and prevents adhesion between them. So to just go through the surgical steps: preparation of the conjunctival flap, you make your ostium as you make, then the scleral flap is sutured. The ologen is implanted directly on top of the scleral flap and the conjunctival flap is closed and anterior chamber is formed. So this I'll skip through totally because Dr. Suchandra has very well presented the complications and all that of mitomycin, followed by the others as well. So the advantages of using an ologen implant: prevention of scar formation, preventing hypotony by creating a buffer system, and collagen matrix decreases the wound cicatrization contraction and promotes formation of a nearly normal subconjunctival stroma. It facilitates proper wound healing and the physiological functional bleb. No prior preparation is required and saves time in the operation theater. It is non-teratogenic and no significant risks known. So we did a couple of studies with ologen, and the acknowledgement is to the Aeon Astron Europe, who provided us with the ologen. So we actually, it was a single surgeon, myself, operating on 31 eyes and into two groups of trabeculectomy with mitomycin and trabeculectomy with ologen, 15 and 16 eyes respectively. And what we concluded was that trab with mitomycin was associated with a higher intraocular pressure lowering efficacy and a higher incidence of post-surgery hypotony and suturalizis in contrast to that of trab with ologen. And the second study was phacotrabeculectomy, again, a total of 34 eyes which were selected, and 18 eyes underwent phacotrabeculectomy with ologen and 16 eyes with MMC. And here we concluded that ologen provides similar surgical outcome in phacotrabeculectomy as compared to adjunctive MMC. It may be a new, safe and effective alternative to MMC for combined phacoemulsification and trabeculectomy surgery. So here is a small video of the phacotrabeculectomy, which so I'll just show the flap here and the ologen. I'll skip the phaco portion of it. So phonics-based flap, as we usually do for trabeculectomy, and generally I do a two-side phacotrabeculectomy sitting in the same place. So that's the flap made, and that's the starting of the phaco. So I'll just skip that portion of the phaco and take it forward into when I go back to the flap, and that's the measurement I'm taking to see whether I need to extend the conjunctiva. and goes in freely, and all you have to do is just place it there and then suture up your conjunctiva. And so there you are, and that's it. So in conclusion, various studies demonstrated significant enhancement of success rates and postoperative IOP through intraoperative use of MMC. This was accompanied by an increase in adverse effects such as cataract formation and all that we've already spoken about. So Ologen implant will also be an adjunctive in repairing postoperative bleb leaks in human subjects. The Ologen implant was tested for augmentation in deep sclerectomy. The study revealed that deep sclerectomy with Ologen implantation is an effective and well-tolerated method for IOP reduction. This is another pilot study which was done, and I told you about it. And in summary of the previous studies, the use of Ologen implant promises comparative IOP reduction after trabeculectomy and a lower risk profile in comparison with the use of antimetabolite like MMC. So these are my references which I used. Thank you very much for your attention.